You are in pain, real pain, the kind that makes time stop existing. There is no hospital nearby, no epidural, no doctor standing at the end of a clean white bed. There is firelight, the sound of wind, and a circle of women who have been through this before you. For roughly 300,000 years, this was the only way any human being arrived on Earth. Today, childbirth is something most people associate with sterile rooms and beeping monitors. But your body, the body doing what it was built to do, it was shaped by millions of years of something else entirely. And what actually happened during those hundreds of thousands of years of birth is stranger, harder, and in some ways more remarkable than anything medicine has invented since. Let's start before the birth itself, before the contractions, before the moment the body announces it is ready. Your ancestor, 9 months pregnant in a world without calendars, would not have known exactly when her child was coming. She would have known the signs, the shifting weight low in her belly, the restlessness at night, the sudden urge to stay close to camp. This behavior has a name, the nesting instinct. Anthropologists and behavioral researchers like Carol Nemiroff have documented it across cultures, and modern obstetric research has confirmed it as a measurable hormonal phenomenon, not a myth. Oxytocin and prolactin levels shift. The body signals preparation. But preparation for what exactly? Here's the first thing that separates ancient birth from what you might picture. It was almost never done alone. This is one of the most important findings in evolutionary anthropology. Sarah Blaffer-Hrdy, a primatologist and evolutionary biologist at the University of California, Davis, spent decades studying what she calls cooperative breeding, the idea that humans, unlike almost all other great apes, are fundamentally built to raise children communally. Other primates do not typically allow strangers near their infants. Chimpanzee mothers clutch their newborns away from every other animal in the group, but human mothers do something extraordinary. They hand the baby off, they let aunts, grandmothers, older sisters, and experienced women in the group touch, hold, and help deliver the child. Hrdy's argument, developed across her landmark 2009 book Mothers and Others, is that this behavior is not cultural. It is evolutionary. Ancient human birth required assistance, not because we are weak, but because we evolved to need it. Why? Because of your skull, specifically the skull of your newborn. Human babies are born with unusually large heads relative to the size of the birth canal. This is a direct consequence of bipedalism. Walking upright narrowed the pelvis, combined with the rapid expansion of the human brain over the last 2 million years. The result is what paleoanthropologist Wenda Trevethan calls the obstetric dilemma. Your baby's head barely fits through the birth canal, and as it does, it rotates in a way no other primates does. It emerges facing away from the mother, which means a birthing woman cannot easily reach down and guide her own child out without risking injury to the infant's neck and spine. This is why, Trevethan argues in her book Human Birth, an evolutionary perspective, the presence of a birth attendant is not a modern medical invention. It is older than civilization. It may be older than our species. So let's reconstruct the scene. You are somewhere between 50,000 and 100,000 years ago. You are in a camp, a loose cluster of shelters made from branches, hide, or rock overhangs, depending on where in the world your group has settled. You are surrounded by people who know you. The older women in the group have seen this before. Many of them have done it themselves. There's no single authority figure, no midwife in the formal sense, but there's accumulated knowledge, passed down through watching, through assisting, through the lived memory of every woman in the group who has survived this before. Labor begins. It can last hours. It can last longer. You move. Walking, squatting, leaning, evidence from skeletal analysis and ethnographic studies of modern hunter-gatherer groups suggests that upright and squatting positions were almost certainly the norm for most of human history. The supine position, lying flat on your back, is largely a medical convention from the 18th century, adopted partly for the convenience of physicians. For hundreds of thousands of years before that, gravity was your ally. The women around you know what to do. They apply pressure. They support your weight. They monitor the rhythm of contractions. Archaeological evidence from burial sites, including findings near Natufian sites in the Levant dating back 12,000 years, shows that certain women in ancient communities were buried with tools and materials consistent with a specialized role. Some researchers believe these may be among the earliest physical traces of a midwifery tradition. And then the baby arrives. In that moment, one of the most striking things about ancient birth was not the pain, not the danger, but something else entirely: noise. Anthropologist Sheila Kitzinger spent her career studying birth across cultures, and one pattern she found over and over again was the use of sound: chanting, rhythmic vocalization, group singing during labor. Not as ritual decoration, as pain management, as focus, as a way of keeping the laboring woman connected to the community around her. The baby is checked, its breathing is assessed. In modern clinical terms, this is what we call the APGAR score. In ancient terms, it was a quick, instinctive assessment by experienced women who knew what a healthy newborn looked and sounded like. Now, here's the part that almost never gets discussed. Not every birth ended well, and not every baby that survived birth was kept. This is one of the hardest truths in the prehistory of childhood. Infanticide, the ending of a newborn's life, existed in ancient human societies. It is documented across dozens of hunter-gatherer cultures studied in the 20th century. Richard Lee's decades-long work with the Jew/Hawansi people of the Kalahari revealed that birth spacing in foraging societies was typically 4 years or more, maintained partly through extended breastfeeding, which suppresses ovulation, and sometimes through infanticide when a new infant arrived before a previous child was old enough to walk independently. In a world where you cannot carry more than one helpless child across difficult terrain, an impossible arithmetic could assert itself. This is not a comfortable fact, but it is a real one, and ignoring it would mean failing to understand the actual conditions in which human life unfolded for most of our history. What does survive in the archaeological record, in ethnographic accounts, in the bones of ancient mothers, is something else too: evidence of care, of investment, of the extraordinary lengths ancient humans went to keep children alive. At Sunghir, a burial site in Russia dated to roughly 34,000 years ago, 2 children were buried together with more than 10,000 ivory beads, fox teeth, pendants, and carved figurines. The sheer labor involved in those grave goods is staggering. Someone loved those children enough to spend weeks or months preparing objects to accompany them in death. Ancient birth was not a clinical event. It was a social one, a communal one, embedded in networks of knowledge, trust, and mutual dependence that our modern world has largely disaggregated into separate private appointments and insurance codes. And here is what you feel today that proves it. That instinct to be with someone when you are in pain, that impulse when something frightening is happening to your body to reach for another human being. The research on what makes birth outcomes better in modern hospitals still points to the same thing it has always pointed to. Not the technology, though the technology saves lives, but the presence of a person who knows you: a doula, a partner, a mother, a friend. The continuous support of a known, trusted companion during labor reduces the use of pain medication, reduces cesarean rates, and improves infant outcomes. This was documented in a 2017 Cochrane review of over 15,000 births. The medical term for that companion is a doula. The ancient term was just the women in your group. You wake up with a newborn on your chest. The fire is still burning. The same women who stayed with you through the night are still there. Your body is flooded with oxytocin, the same hormone that drove your nesting instinct weeks ago, that powered your contractions, that is now making you feel, despite the pain and exhaustion, something close to euphoria. For 300,000 years, this was how it began. Not in a hospital, not alone, not clean, in firelight, surrounded by people who knew you and who needed you to survive.